Some startling news tonight about the quality of hospital care. An investigation found that hospital workers report only 1 in 7 medical mistakes on Medicare patients. And even when the errors are reported, little is done to stop them from happening again. So what are these errors? Here's ABC's Dr. Richard Besser.
Mary Brennan Taylor's mother went to the hospital with a simple case of gout.
You should not go into the hospital for gout and die 48 days later.
Marcus Glover went in for shoulder surgery and came out with a dangerous infection.
The pain is like somebody hit me in my stomach with a bat.
Today's report says that not only are errors happening in hospitals, but most are going unreported. In 293 cases where patients were hurt, only 14% were reported.
We don't know the full magnitude of how many patients are harmed, but some estimates say it's 1 in 10.
And most of them can be prevented. Dr. Peter Pronovost is part of the team that pioneered an answer that seems so simple, a checklist of proper procedures, just like airline pilots use before they take off. In the operating room, it reduced deaths by a staggering 46%. A checklist costs nothing, but not every hospital uses one. So what can you do? Ask if your hospital is using a checklist. Have someone with you in the hospital who can tell nurses and doctors if you're not acting like yourself. Bring a list of all the medications you take. And that basic one, if you don't see them wash their hands, speak up. It's your right. For Mary's mom, it was medication error. Her mother became disoriented.
They could have said to me, "Is this your mother? Is this how your mother normally acts?" They did not.
If hospitals react to today's report the way they should, medical mistakes will be noticed, reported, and, it's hoped, reduced. Dr. Richard Besser, ABC News, New York.